So President Cyril Ramaphosa is expected to announce stricter lockdown restrictions when he addresses the nation at 8 p.m. tonight. And this follows the announcement yesterday that the highly transmissible Delta variant, first identified in India, has now spread across South Africa. In the latest figures released, South Africa has just over 152,000 active COVID-19 cases after 17,958 new infections were recorded. This represents a 25.6% positivity rate. Another 157 people have succumbed to the virus, bringing the death toll in the country to 59,778. That number can't be abstract. Our recovery rate stands at 88.9%. The Delta variant has affected KwaZulu-Natal, Gauteng, and the Western Cape with the highest infection rates.
We are in the third wave. We continue to see infections rapidly rising, and the number of these infections continue to rise, and Gauteng continues to be the epicenter of these new infections. We remain very worried about the rise in the hospitalization, which is putting a lot of strain in the health facilities in Gauteng. The trends are clearly showing that other provinces are going to experience the trend we are seeing in Gauteng, notably in the Western and Eastern Cape. Nationally, the numbers have surpassed the first wave peak, and we are likely to surpass the second wave peak.
A chilling picture of the havoc the COVID-19 virus is wreaking on the country. A new variant has been discovered.
Our scientists, after their sequencing experiments, have discovered that we have a new variant that is prevalent in our country. This new variant is called a Delta. You know that it's not a new in terms of existing only in South Africa. It exists in other countries.
The new variant is dominating in the country and is a higher risk of reinfection.
This is the variant that caused initially a massive epidemic in India and seemed to be increased very fast in frequency and dominating the infections in South Africa. We will be gathering more data in the next few weeks, so let me show you where this data is coming from. So here what we are breaking down by province, with KwaZulu-Natal, Gauteng, and Western Cape, the most sample provinces. And you can see here that you had completely domination of the Beta variant, and then start appearing some other variants, the Alpha and the Delta. But in the more recent data that we did as a community transmission in South Africa, in KwaZulu-Natal, and now we are busy working on Gauteng.
While the current vaccines will still be effective against this new variant, harsher restrictions have been mooted.
If we want to reduce the transmission rates, we're going to need to make sure that actually we get onto hard restrictions, tighter restrictions, because obviously what actually increases transmission is from person to person. And it's going to mean we need to be very decisive and go to an extent of saying, how do we then restrict movement of persons, and how do we actually, how are we going to do that? And that needs to be done very urgently.
We presented the information about the Delta variant. Out of that, then a decision has been taken for NetJoint to consider whether the restrictions that we currently have are sufficient. There is a belief that the current restrictions, especially when we deal with Gauteng, are not sufficient, and therefore recommendations will be made.
Nozintombi Mia, SABC News, Johannesburg.
All right, that sets up our next interview. Health experts are, as you know, appealing to South Africans to refrain from social gatherings and adhere to all COVID-19 precautionary measures. South Africa is battling to curb the highly transmissible Delta variant, which is now circulating in the country. What do we know so far with regards to this variant? Let's bring in a better mind. The acting executive director of the National Institute for Communicable Diseases, Professor Adrian Puren. Welcome, sir. Always a pleasure having you on the program. All right, we're having a bit of an issue with Professor Puren's sound. Can you hear us now, sir?
Yes, I can now
All
hear
right,
you.
100%.
Good morning, Blaine, and good morning to your listeners.
Good morning to
Viewers.
you. Thank you very much indeed for taking the opportunity. The WHO's Dr. Maria van Kerkhove, I heard her speak the other day saying that this Delta variant is more transmissible than the Alpha variant, which was extremely transmissible across Europe, across any country it entered. Your level of concern, sir?
Yes, it is of great concern that we now have this variant in community circulation. I think we did report earlier, I think it was in May or thereabouts, that in fact both the Alpha and the Delta variant were in circulation, but to the extent that we did not know. And of course, the data that was released yesterday by Professor Tullio de Oliveira certainly shows that at least in KwaZulu-Natal and I think in the Western Cape, that the Delta variant has certainly become the dominant variant. And what we do know is that this variant, which was originally described in India, has a high degree of transmissibility, even higher than our current variant that was dominant, which was the Beta variant, as well as the Alpha variant that was in the UK. And as you know, the Alpha variant was thought to be the super spreader virus, but in fact the Delta has certainly displaced that. Even in the UK, as the vaccine program became very effective, it was actually the Delta variant that became the dominant virus in circulation. And I think that in South Africa, although we'll see what the data shows from Gauteng, but indeed, because this Delta variant is so transmissible, it's likely to displace, even if we did have the Alpha variant in circulation, the Delta variant will become the dominant strain in circulation.
So scientists have established that it's more transmissible, but have we established whether it's more deadly?
No, I think that there's still some important data that needs to come through. I think there are early indications that it's certainly highly transmissible. Therefore, we will see, and I think that explains in part what we're currently seeing in Gauteng and likely to see in other provinces where the Delta variant become the dominant lineage or variant, that in fact you'll have large numbers. The important consideration, you're quite right, is will this translate into higher rates in terms of severe disease? It's possible that this may be the case, but I don't think that all the evidence is in place for that. I think the other important factors are, for example, in terms of reinfection. And again, I think there's some data from the UK, at least, to show that it may not be the case that you will have higher rates of reinfection, but that remains to be determined, as well as the fact that we are rolling out a vaccine program. Yeah. And again, at least with regard to the Pfizer and I think the AstraZeneca, the evidence is that even if you had one dose, there'll be a certain level of protection, but the best or better protection is to have both doses of the vaccine. So those are the implications for South Africa. Yeah.
Vaccines are aimed at preventing severe disease and death, including against the Delta variant and the, as you mentioned, the sublineages of the Delta variant. How does this variant change the way we are currently dealing, though, with the pandemic and its implications on South Africa's vaccination program?
Well, as you know, we did have an associated highly transmissible variant when we did have the second resurgence. And our approach was really, again, a risk-adjusted approach. In other words, we had certain steps with regard to moving to stage 2 and then stage 3 type lockdowns. And as you know, with this current third wave, again, when we had the modeling scenarios, it did not take into account that, in fact, there would be a new variant. But in fact, that was a critical consideration, that were that variant to happen, that would certainly change the dynamics. But so within that risk mitigation strategy, I think we really need to look at within that, what can we do? And I think we will probably be looking, or the National Department of Health and obviously ultimately the government of South Africa will look at what can be done within that level 3 or even a level 4 in terms of reduction of contact, because that's the key aspect here. If we can reduce contact, that means we can reduce transmission. So within that, again, looking at sizes that are allowed in terms of how many people can congregate within particular settings, perhaps reduce that even more dramatically, maybe longer hours of curfew. Those are the types of aspects that need to be taken into consideration. I think also importantly is, again, to revitalize and reassert the non-pharmaceutical interventions, because that's all we have currently. I know we have a vaccine program, but we have not reached the levels where we can say that this is going to really necessarily contribute right now to what we're currently seeing. So the non-pharmaceutical interventions, such as the wearing of masks, wearing them correctly, the physical distancing, the smaller levels of congregations, in terms of congregant events, whatever those are, as well as ventilation. These are the key aspects that need to be reinforced, and we need to re-engage with our communities. I know it is a struggle in certain particular settings to really engage and reinforce these, but I think it's really important to see how best we can certainly institute those MPIs again and again.
I think the key is Professor. Our health at this stage is interlinked, and I always say, our strength needs to be a function of our respect for one another, and we can respect one another by doing those non-pharmaceutical measures in terms of wearing a mask, etc. Back to the vaccines, we are currently using the J&J as well as the Pfizer jabs. They are, as you heard, calls for us to start using the Sputnik V and the Sinopharm vaccines. What about AstraZeneca? Should we be re-looking at that jab? What do we know about its protection against hospitalizations from the Delta variant?
Yes, so the data that I was quoting, in fact, I think does in part come from the UK, that in fact the AstraZeneca, the two-dose approach there certainly provides a high degree of protection. It's not to the same extent as it does to the Alpha, but certainly, although the efficacy is reduced, it's still fairly effective in terms of protection. So yes, I know South Africa is looking at a range of vaccines, so certainly I would think that given that it had received initial approval, and given that there's new data to show that the AstraZeneca is effective against the Delta variant, my sense would be that I'm sure SAPRA will reconsider the reintroduction of that particular vaccine were to be introduced again. Yes, of course.
I was listening to the WHO's Dr. Maria van Kerkhove saying that there are 4 variants of concern that are circulating worldwide. There are about 7 variants of interest that scientists are tracking, and there are a number of other alerts that are on the WHO's radar in terms of understanding what constellations of mutations that are out there. Talk to us, Professor, about South Africa's sequencing experiments. This phrase that we tend to stumble over, my small brain can't handle it, but break it down. How do we discover these new variants?
Yeah, so what is key here is, and I don't think we should call it experiments really, the sequencing of these variants is really critical and ongoing. As you know, the first sequences that allowed for vaccines to happen were really very soon after. So these viruses are, if you like, disaggregated so that we can look at the nuclear material, and we look at what constitutes that nuclear material. What is the code, if you like? It's like looking at a library. But this library is a living library, and it evolves. It evolves naturally within the body. As soon as it enters, there can be what we call mutations. So in other words, if you had a set of 10 encyclopedias from A to Z, now you have an evolution as it comes into contact with humans. And it evolves in part to escape and also to be transmissible, escape from the antibody responses. So it certainly evolves, and we thought it evolved very slowly, but in fact, the variants of concern, in particular the Alpha, the Beta, the Delta, and those 3, in fact, have evolved very dramatically, in fact, that it contained, in the case of the variants from South Africa and from India, contained changes that affected not only transmissibility, but also immune evasion. So critically within South Africa, and I think we were very fortunate that early on in this particular outbreak or pandemic, that in fact we had the ability to sequence the virus to see what are those changes and what those changes would mean. And so we're constantly monitoring for that. So in fact, we're obviously keen to see whether or not the variant from Brazil, for example, is in circulation. But so far, that is not the case. I think the concern now is that we have this Delta variant, but would there be another variant that will come along and displace that in terms of its ability to transmit very effectively, but also to escape the vaccines, for example, and some of the pre-existent natural immunity. So it's really a key part. I think many people didn't think that, in fact, the molecular dissection of these viruses would be critical. We thought that, it's like measles, there's very little changes. But in fact, it's really important. Like HIV, the virus evolves very rapidly, and that makes it very difficult to target your drugs, to target your vaccines, for example.
Is the symptom profile different with the Delta variant, or does it depend on age groups, etc., for instance?
Yeah, I haven't seen much on that, but I understand that, in fact, from the UK and I think from the United States, that, in fact, the onset of headache, a running nose and sore throat are the more likely symptoms or key symptoms, as opposed to that, the previously when we said severe onset of shortness of breath, for example, fever and so forth. So I think we'll have to look at that constellation, because that constellation could be anything. It could be your COVID-19 infection. It could be other viruses such as influenza, for example. So I think it's a high index of suspicion were you to have any of that range of symptoms for you to be tested, especially if you are struggling with your symptoms such as breathing, for example, that you may need attention. Yes, of course.
So let's talk about when we eventually get to that better place that we're all seeking to achieve. Once, if all goes according to plan, we reach the so-called herd immunity, where the majority of the population is vaccinated. What then? Because we know that vaccines prevent severe disease and death. It doesn't necessarily prevent you from getting or contracting the virus. In terms of medication, what happens after that? Is it the symptoms that you spoke about? Is it just going to be treated with the general medication that is out there, or are we working on specific medication post this pandemic?
So I'm sure in terms of severe disease as well as mild disease, I'm sure there are efforts to try and understand how to manage and control that. As you know, influenza, for example, there have been various drugs that have been developed. With regard to COVID-19, I'm sure that there are ongoing studies to determine how to manage perhaps even mild or moderate symptoms, as well as obviously severe disease as well, especially if you end up in ICU. It's not just the oxygen that's required, but also dexamethasone, remdesivir. I'm sure there's a whole host of, for example, antibodies that are certainly being investigated. I know that the initial antibodies that were used, the so-called monoclonal antibodies, were not effective because of the variants, but I'm sure that there are additional monoclonal antibodies that will certainly be used. So I think there'll be a range of medications that certainly will be useful and used. And it, of course, depends on how the virus evolves. I think what we're seeing virtually with those variants of concern is like a convergence of changes that lead to similar outcomes. In other words, higher transmissibility, immune evasion. That's been the key over the last few months. And I think that's that monitoring. Will there be further adaptations? Because the virus will adapt, but not to the point where those adaptations lead to its end game, as it were. So it will be interesting to see how this virus evolves and how we respond to that. So again, I think the key is, as I've emphasized, the MPIs will have to continue for a very long period of time, even as we approach high levels of herd immunity, because given that this is a highly transmissible virus, and if that is the dominant virus, then our initial concept around herd immunity may well change. So in fact, we may have to say, well, we'll have to adapt that we'll only achieve 60 to 70% of immunity in the community. And we'll have to adapt to that, for example, if we can't achieve higher levels of immunity because of, for example, hesitancy around vaccines. So those are the sort of factors that we'll have to take into account.
So having said all that, what's your expectations with regards to the address tonight by the president in terms of the various levels, restrictions? What do you think?
Well, I think it's very difficult. I think we can't see the economy and this epidemic as two separate events. So they are obviously interlinked, and that has been stated from the outset by the South African government. And so I think it's really, as I said earlier on, it's really trying to fashion out within, by keeping the economy going, how do we protect lives? And how do we manage that within the context of our current restrictions that we do have? Can we reinforce, re-engage in terms of the NPIs and the numbers, but even more so around the numbers? What in addition can we do? In other words, really trying to look at so-called events that will lead to super spreading, those congregant events. How can we even limit those even further or even stop those particular events? Because I think that's what is actually occurring, is that it's likely that we have those events. But also at an individual or family unit level again. My concern is that the social bubbles, the safety bubbles are crashing into each other. And we really need to work back and step back and really ensure that we keep to our safe bubbles in order to limit transmission at that individual or family unit level. I know it is a struggle in different settings to achieve that, but let's see what we can certainly do.
The fatigue of forbearance, that's what we keep on hearing all the time. Sir, we thank you very much indeed. Always a pleasure having you, always instructive. Be well.
Thank you very much for the opportunity.
All right, that was Acting Executive Director of the NICD, Professor Adrian Puren.